Good. Okay. Okay. So now we're going to talk about the trichomoniasis, which is another type of vaginitis. This is another type of vaginitis. Trichomoniasis. This is caused by Trichomona vaginalis. Okay. Trichomona vaginalis. This is a protozoa that is motile because it has a flagella and it's anaerobic. Anaerobic protozoan with a flagella. Okay. Mode of transmission. This is transmitted through sex. Now, unique clinical features, unique clinical findings to this one. Unique one. Malodorous, greenish discharge. And a physical exam shows a what's described as a strawberry cervix. Strawberry cervix. Now, if you do a saline wet mount of the vaginal smear, it will show you. These are tests that you guys are going to do in the office, especially if you work in a gynecology office. It's going to show you a protozoa with multiple flagella. The pH of the vaginal discharge is going to be greater than 4.5, which is different from the Candida vaginitis. The vaginal pH over there is going to be between 4 to 4.5. Here is going to be more than 4.5. Trichomoniasis, this is actually considered a sexually transmitted disease. Trichomoniasis is considered an STD. Then we have the other vaginosis, which is bacterial vaginosis. Now, bacterial vaginosis is the most common vaginal infection in women. Most common vaginal infection in women. It's caused by Gardnerella vaginalis, which is a pleomorphic, which means has different multiple shapes. Pleomorphic gram variable, which means it doesn't really stain that well. Doesn't stain gram positive or gram negative, so it has a gram variable, gram stains. Facultative anaerobic. Okay. What causes this? Okay. What's the pathogenesis? A risk factor that causes the normal lactobacilli flora concentration to decrease or lower, allowing for the overgrowth of the Gardnerella vaginalis. What's unique in the pathogenesis here is that there is going to be no vaginal epithelial inflammation. You're not going to see vaginal epithelial inflammation because of a absent immune response. The most important primary risk factor for this is sexual intercourse. But you have to absolutely keep in mind that bacterial vaginosis is not considered a sexually transmitted infection. So because we said that it causes no vaginal epithelial inflammation, it makes sense to say that on clinical exam, most commonly it's going to be asymptomatic. There is going to be no swelling or redness anywhere. So there's going to be, the only thing obviously is the increased vaginal discharge, usually gray or milky with a fishy odor. Now, other risk factors that are important, and remember, these risk factors are going to disrupt the normal vaginal flora. These risk factors include intrauterine devices, douching practices, and pregnancy. Again, because there is no inflammation, the patients are not going to they're not going to really complain of itching and pain. Okay. So what are unique diagnostic features of um, bacterial vaginosis? First, they will have what's called a positive whiff test. This is a intensified fishy odor when a sample of 10% potassium hydroxide is added to the vaginal fluid. Okay, a very, very fishy odor. So that's a positive whiff test